very good evening to all the lovely audience who have tuned in to watch us live today. I'm Sharmishta Parmar, the admin of Parent Station Ahmedabad, and I welcome you all to the session of Expert Talk. Dear friends, do you know that every year on 20th October, World Osteoporosis Day is observed? And it is observed to raise awareness for prevention, diagnosis, and treatment of osteoporosis. And so we thought, why not invite an orthopedic on our platform? And so today we have with us Dr. Tejas Thakker, who is a senior orthopedic consultant at Apollo Hospital. He has an experience of over 20 years in the field of orthopedic, and he's here to share with us all his knowledge about osteoporosis. He's going to help us and learn and make us learn more about osteoporosis. Dr. Tejas Thakker, welcome to Parent Station platform.
Thank you. Thank you very much, Mrs. Parmar. It's a wonderful initiative. I must say that Parent Station is doing something excellent for a public awareness kind of a thing. And good going.
Thank you so much. And so without wasting a minute, let's directly jump into the question answer session so we get every bit of it from you. So let us start from a very scratch. Please let us know what is osteoporosis exactly.
Osteoporosis is basically a soft bones, I can say, that there is a depletion or a deficiency of calcium in your bones, and that will lead to the fragile bones. It is the right word is a fragile bone where you have a more tendency towards fracture, and that is osteoporosis.
Okay. And what are the main causes for this?
The main cause is lack of calcium intake. In the 90% of the patient, there is a calcium intake deficiency which is causing the osteoporosis. There are a few other causes as well, but in general, by and large, for a common people, we can understand that it is a lack of calcium which is causing osteoporosis.
So, like other, whenever we get something, any disease or something, we go for a test. So, what type of test do an osteoporosis patient has to undergo?
There are a number of tests available, including blood tests, X-rays, MRI. But the most specific test for osteoporosis is a bone density test. If you have heard the name DEXA, this is a dual energy X-ray absorptiometry. That is this one kind of a scan where the machine measures the amount of calcium in your 4 different regions of the body. With that, there is a one scoring system is there, and that will give you the idea that whether you have osteoporosis or not. So DEXA is the method to test.
Okay, so how much how much percentage the bone is damaged or something? We do come to know with those tests.
It is not exactly the percentage of bone deficiency, but it is to compare with the normal healthy adults. Like there are some score, T score and Z score, where we compare, the machine compares or a software compares the amount of your bone calcium and the normal bone's calcium. That will give you one score, and that score will decide that yes, you have a deficiency, severe kind of, or a mild or a moderate kind of. Where there is a severe kind of a score deficiency, that is osteoporosis.
Okay. So as we all know, nowadays we have all shifted to online, and maximum time is spent sitting near the laptop. So if an osteoporosis patient is going to sit for a long, how is it advisable, or sitting long is bad for osteoporosis patient? What do you have to say about this?
No, I would say that sitting is just not an issue. But if you going for a toe touch, or if you are doing a sit up with osteoporosis, that can really bother you because you are walking on an eggshell kind of a thing. When you have a fragile bone, that can really break, particularly in your spine. The weak bones can break easily. That's the fragile or a fragility kind of a thing. So sitting as such is not. I would say it won't bother you, but sitting with a sneeze, even a forceful sneeze, can cause you a fracture with osteoporosis. So one has to be careful while sitting, I would say.
Okay. So any specific chairs are there for them or something like that, which they have to sit with a pillow or something like that? Would you?
No, no. For osteoporosis, you don't need any specific chair. No.
Okay. And what about walking? They can go for a walk?
Walking is excellent. Walking is excellent because any type of exercise, especially when you talk about a brisk walk, that can help you. Help you in the sense that a brisk walking will make your bones more stronger. The bone will have imbibed more calcium. That will make, uh, that would be a remedy to osteoporosis treatment, I would say. So, brisk walking or any kind of exercise like a jogging, aerobics, even playing some badminton or tennis can be of help to fight against osteoporosis.
Okay. So since our platform is a parent station platform, and I know many parents out there would like to know that how is osteoporosis there in children also?
No, osteoporosis in children usually cannot affect the children. It usually affect female of 45 plus kind of age. Uh, that is most common. If there is a
Okay.
weakness of calcium in your child, then it won't be osteoporosis. It can be something else, like one has to see an endocrinologist or even somebody has to see a pediatric doctor, but it won't be called as osteoporosis, I would say.
Okay. 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 And you talked about women. How about men? At what age do they get?
No, they get at a similar age, but what is the basic difference between them, both this male and female, is that female, the menopause will happen, and that menopause will cause some decrease in the sex hormones. And because those hormones are important for a calcium absorption and making bones strong. So when there's a menopause, they will start with the deficiency of calcium. In a man, also similar kind of thing will happen after 50 years of it. But as there is no hormonal change, it will start getting reduced very slowly. So if a female of four female are affected, then one man is getting affected. So it is 4 times more common in women rather than men.
Okay. Okay. So, like we talk about everything now, that the age group we knew and who is affected, and so what is the treatment?
There are a number of treatments available for a osteoporosis. First and foremost is calcium and vitamin D3, and there are few injections available. There are few medicines available for osteoporosis. It all depends on what degree of osteoporosis you have on DEXA scan. You cannot just start the treatment thinking that, oh, you have osteoporosis. Not like that. One has to measure it and then to start treatment. Depending on what degree, you can start the treatment.
And specifically, which body organ gets affected when we get osteoporosis?
So, in as such, the bones are getting affected with the osteoporosis. But what is more common bone is a spine, hip, and the wrist bones. These are the most common area to get affected. There are proximal humerus like a shoulder joint, or maybe sometimes other bones also get affected. But if you say spine, hip, and wrist, these are the most three common joints to get affected with the osteoporosis.
Okay, so there is nothing to do with the knee. The knees are
No, no, no.
okay.
One has to
Okay.
understand that the knee joint is a joint problem, which is osteoarthritis. This is different from the osteoporosis.
Okay. 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 And what will happen if one doesn't go for any treatment and just doesn't get any treatment done? What will happen at a long duration?
What will happen is that because of osteoporosis, there will be a there are two three dimensions to it. So it's a little longer reply to this question. What will happen is that your back will get little hump, like this should be the back.
Okay.
It will happen like this. So there will be a decrease in the height, and it is for any human, when there's a decrease in the height, they will feel little low as well. With a more height, you get more confidence, that kind of a thing. With a loss of height, you will have some psychological disappointment. That is first. Second, you can have a fracture. Third, you won't be able to do all kind of normal things in your life, like jumping and all those things has to be prohibited. And even if you do, you won't have the confidence to make those things happen. And most important, it's a financial loss, because if osteoporosis per se will not do any harm, but if you don't treat osteoporosis, it will increase the financial and physical burden on you. So that's how the osteoporosis can affect. So there's no point to be adamant against treatment of osteoporosis. One has to get treated with osteoporosis.
So, if what is a particular diet patient should follow or everybody should follow so that they don't get into this? If we already like, if a woman age of 40 starts a very good healthy diet, and so he or she might
This
not get osteoporosis.
no, 40 is too late to start with.
Okay,
So
so the healthy
yeah,
diet has to be from the very beginning.
so you are around 20 years late for that. So
Yeah.
so one has to start at a 20 years of age, because what is happening is that in a human body, the calcium is at peak in late 20s. So you have to build at that moment. If you haven't built at that moment, after 30 or 35, it start reduction. So what अगर बैंक में जमा होगा तो तुम वो कर पाओगे ना. So that means that 20 at 25 you need to deposit that strong calcium, and then it start depleting. So woman of 40 can just be happy with what she has, I would say. I mean that she has to continue with that amount of calcium, and she is supposed to see that there is no more deficiency of calcium anymore. She cannot deposit anymore, but at least your loss is happening post menopause or perimenopause. She can compensate with a diet and exercise. Most important thing in a diet, the milk, a fig, the dry fig, or maybe banana, dairy products, all kind of fruits like fruits like pineapple, or a guava, orange, which are rich in vitamin C, will help you to strengthen your bone. Even broccoli can help you to fight against osteoporosis.
Okay. So if we are taking this, and apart from that, regularly we are supposed to take the calcium tablets.
No, it depends
If
whether
this
you
is
have
our
a
diet.
symptom. No, it depends whether you have a symptoms or not. If
Okay.
you have a symptom of a bone pain, if you have a symptom of getting a lethargy, if you have a symptoms of that tested on DEXA that you have a deficiency of calcium, then you need to start with the calcium and vitamin D3. If you do not have a symptoms, if you have still not went in menopause, otherwise, just knowing osteoporosis, that does not mean that you should start with the treatment. That is not a right way. So you start with a diet and start doing regular exercise, at least 30-40 minutes once, 3 to 4 times in a week. That is the exercise. So that much if you are doing, it's fair enough. And if you do not have a symptoms, you do not need a calcium tablet.
Okay. Okay. Great. The diet which you said is going to be helpful to our parents out there, especially women
Okay.
out there who are going to face the problem, who are in their menopause phase. Sir, is this osteoporosis running in the family? Does it
There are
carry?
some inheritant genes for the osteoporosis, that if your close relative or a close blood relative has a history of fracture related to osteoporosis, there are few percentage chances increase for you to have osteoporosis and so the fracture.
Okay. So, what is the best thing to do for osteoporosis?
I would say the best thing to do is prevention. So one should try and get a best strong bones from the age of 20 or 25. If that has happened, osteoporosis may not happen to you. So that is first. That is a primary prevention, I would say. The secondary prevention can be you be aware about osteoporosis. That there is something like osteoporosis which can make you, which can really bother you, which can cause you a fracture, and that fracture can be really morbid and debilitating. So that is a second thing. Third thing, if you are aware about osteoporosis and the treatment is also available, you should try and visit your doctor whenever needed, and do not be adamant about getting a treatment. So these are the four basic philosophical steps, and then one has to follow the advice given by your doctor, and you should be fine with that.
Lovely. That was so much informative for all of us today. And any closing statement from your side, Dr. Tejas? What would you
The
like to
closing
say to our audience?
I would say that healthy bones are not very difficult thing if you have a good lifestyle. One has to understand the science. It is not only your emotions which can make your bones strong, but yes, positive vibes are very important, particularly for a female of perimenopausal age. It is good. It is extremely important to be happy in your own ways. Your happiness will make your bones surely more healthy because you will love yourself. If you love yourself, you will take good care of your body. If you took good care of your body, your bones will be healthy, and so your orthopedic surgeon will be happy.
So, nobody need to visit you then.
Yeah, fair enough. I'm happy to be very free and doing this online presentations.
Frankly speaking, sir, I haven't taken milk from my childhood days, I guess. I'm a tea lover and a coffee lover. I used to be a tea lover, now shifted to coffee. So, is it that जिसने दूध नहीं पिया उसको तो होना ही होना है?
No, it is science is yet to prove that दूध नहीं पिया तो maybe you might have taken something else which can give you some calcium. So I do not think that the milk is the only sole source of the calcium. If one may not tolerate sometimes milk, then there are other dairy products are available, other fruits available, other vegetables available, even non-veg like a fish oil, cod liver oil, which are good. So that can be taken. So there are n number of things, but you have to be aware that you need something for your calcium. It is not only the milk.
Yes. Yes. Lovely, lovely. It was so great talking to you. Thank you so much for coming on our platform and giving us so much information about osteoporosis. Thank you so much.
Thank you, madam. My pleasure.